Evening, I'm Miranda Yoder. Welcome to my presentation. I'm going to do this through Zoom and share my screen so that you can follow along with my lovely PowerPoint here. If I can get this to work. Perfect. Okay. So like I said, my name is Miranda. I have been a registered nurse for 8 years, going on 8 years in August. And I'm here this evening to discuss high-fidelity simulation, which is basically a growing technology trend in the field of nursing especially. So I've worked as a bedside nurse for these 8 years, and in my time as a bedside nurse, I have trained new hires to my units. A lot of those new hires have been new graduate nurses. I've also precepted nursing students to my units, and I've worked with some clinical rotations that have come through these units. Aside from my regular role as a bedside nurse, I also teach clinicals 1 day a week for Central Ohio Technical College out of Newark. I work for their RN program, so their associate degree nursing program. And I've been doing that since January of 2020, minus some time off during COVID when we were displaced from clinical. But in that short year and a half, basically, I have made some significant observations working with these students. I teach first year, third semester nursing students, and I've learned a lot from them. So what I've learned while working with these students is that they really lack confidence when they perform head-to-toe assessments, which is one of the things that I work really hard with them on. They also lack confidence when they talk to the bedside nursing staff. If it's to communicate a change in a patient's condition or to communicate a pertinent finding that they've done during their assessment, they just don't have that confidence when they bring that information to the attention of the bedside nurse. And they also lack a lot of confidence in some really critical things such as cardiac and respiratory complications. So I believe that high fidelity simulations are very valuable and can help us solve a lot of the problems that we're seeing with some of our new nursing graduates. So a little history. High fidelity simulations are pretty much exactly what they sound like. They're simulators. In technological terms, the term fidelity refers to the degree of exact realistic nature that technological equipment can achieve. So basically, how real the computer can make a scenario. A prime example of high fidelity simulators are mannequins, such as the mannequin here on the slide. These are often used in labs, and they're basically so that the rescuer in this scenario, which would be you or I or a student, can work on this mannequin, and the mannequin's condition will change based upon what actions we are taking. So these mannequins are hooked up to computers, like you can see this lovely mannequin here is. This one, for example, is used for CPR renewal. This looks like the exact setup that we have at the hospital that I work at. And they're really cool. They're really nice to work with. I like them. So why do we need high fidelity simulation? So it's in my opinion that every nursing college or even every medical school should have high fidelity simulation of some sort. Why? There are several prime reasons. I have learned very quickly that COVID is a prime example of this. So even though we were displacing students from lab time, in classroom, things like that, they got displaced from clinical. But if we could get simulators into lab and possibly still get students safely working in those labs so that they're not losing as much clinical experience, that would be ideal. And these mannequins can mimic actual patients. Another prime example is that in their time in nursing school, not all students are going to get the same clinical experience. We have to go where we can get clinical sites. No clinical instructor is going to run clinical exactly like another clinical instructor. We just have certain terms that we have to meet, right? But if we have these simulation times that we set up in lab, for example, for nursing students, If we can get these scenarios set up for them, we can have a universal educational experience for our students across the board. That way everyone is still getting an equal amount of clinical experience with these simulation mannequins. And the biggest benefit is that students can practice on these mannequins before actually working with live patients. We would never let a pilot fly an airplane right off the bat. Of course, we want them to do flight simulators first because that would be dangerous. So as we're, the field of nursing is developing and we're doing more and more skills and the way that we do skills is changing, if we can continue to get students practicing on these real life mannequins first, we're only going to help patient safety. And in addition, the nice thing about these simulations as well too is that the instructors can actually role play along with the student. So they can role play as the patient and speak as the patient, for instance, or they can role play as a doctor in the room, or like maybe a doctor on the other end of a phone call. One of my favorite parts about when I was in nursing school was my simulation time. We had a simulation room and you had a patient's hospital room, and there was basically like a viewing glass, a two-way mirror, so to speak, in the room, so that one half of the lab could be observing while we were in with our mannequin patient. And the instructor would speak as the patient and then role play as that doctor on the other end of the line. It would all be video recorded, and then afterwards we would debrief. So looking at some of the literature when I've been doing research, which there's actually a lot of research on high fidelity simulation, and I was really interested to learn more about that terminology myself because I've never heard the terminology high fidelity. I looked up some like educational strategies. What I thought was really interesting was this term called cognitive burden, which was introduced by a couple researchers named Carey and Rosler. So they warned that just because something is more realistic, don't expect that students will learn better or learn more necessarily. And this term cognitive burden is basically the idea that if the technology is too good, a student's brain can become overwhelmed very easily and actually cause this cognitive burden. So it's just too much for their brain to handle and process. So we have to be careful when we're using this type of technology that we don't cause too much stress and that we can actually get them focused on learning. We can get really caught up easily in new technology and being exposed to it. We need to make sure that they're getting that valuable learning experience out of all of this. And some ways that we can improve patient outcomes. So a study by Lacera and some colleagues suggested that outcomes for nursing students can further be enhanced with repeated simulations throughout their nursing curriculum. Another researcher named Prasado and their colleagues stated that when students participate in these simulations, they develop better teamwork, communication, and leadership skills. And to continue on, those nursing students who have been trained in high fidelity simulations were actually found to have better judgment and improved response to a patient's clinical deterioration after working with these high fidelity simulations. So basically we're improving their quality of care that they deliver. We're training better nurses for our workforce when we use these simulations, and they can join our ranks and be more prepared to handle these clinical situations. In addition, this also helps enhance their critical thinking skills, and this allows the new graduate nurses to learn how to better advocate for the needs of their patients. We all know that as nurses, we spend the most time with our patients, so we're very quick to pick up on any little subtle sign of clinical deterioration, and we need to have solid evidence to bring to the practitioner to say, hey, something's not right, here's what I think is going on, and here's what I think we need to do. And in order to get the students to that level, they need the critical thinking and they need that really good assessment skill, which is basically the exact two things that we can test and get established during simulation time. There it is. Finally, if we do these simulations, this also gives us a really nice time where we can actually formally debrief with students after they've done a clinical simulation. So back to Prasado and their colleagues, they cited that debriefing after a simulation experience can teach students to become more accepting of criticism and more accepting of feedback for critiques of the nursing practice that they're doing. This debriefing time gives us a chance to actually enhance the quality of care, because we can use this time to have students observe each other so that they're learning by observing each other, but also picking up on things that the others may have missed. So they're able to review and critique one another. And that's good professional team building and teaching them better communication skills. And it helps the learning all around. So proposal ideas and implementation strategies. So the first step to all of this is that colleges and universities need to make the decisions to purchase these high fidelity simulators, just like the mannequins, as I've shown earlier. That's going to take a lot of education and basically laying out the benefits that we have using these types of mannequins. I know the college that I teach for, they currently do not have a mannequin, one of these high fidelity simulators. They have CPR mannequins, but they're not hooked up to any computers. It's not high fidelity by any means. It's not technological by any means. Of course, this all comes at a cost, which I'll discuss in a future slide, but I think that the benefit of this outweighs the price tag, so to speak. The next thing is that curriculum needs to be formatted around utilizing the high fidelity simulation. And we really should be focusing on getting as much lab time to these students as we can that is designated specifically for the simulation experience as often as possible. And finally, we need to determine how to evaluate the outcomes from implementation of high fidelity simulation. And some evaluation ideas. So how can we make lab time more valuable for our students? Should we just be doing computerized testing only? What about simulation? So I think, in my opinion, that we should focus on implementing rating systems using simulators instead of using so many written tests. We need to see that they can perform nursing tasks hands-on while also being quizzed on nursing knowledge and critical thinking skills. Now with this, we also need to make sure this curriculum that we're implementing focused more on these simulations and simulation testing. We need to evaluate whether or not that's going to also help them pass that ever important NCLEX exam. And interestingly enough, some of the researchers had some really good quotes talking about these evaluation techniques. The biggest thing that I kind of heard resonate through all this research is that students learn better by doing things. They develop muscle memory, which helps retain information. Researchers Carey and Rosler noted that even emotional experiences that occur during simulation have proven to aid in actual information retention amongst students. So even if a student, has a sad emotion related to the simulation and some sort of negative emotion, they're never going to forget that. And that'll stick in their brain. And they're going to remember, I need to not do that next time, or I need to remember to do that next time. Now, this does come with some ethical and legal issues. Sitting back and thinking about it, in reality, because we're allowing students more time to practice skills on mannequins using these simulators, this really only enhances patient safety. So honestly, there's really no foreseeable risk or any legal or ethical issues for patient care. Now, where we do run into some possible issues is we have to remember that students are protected by FERPA, the FERPA, and they have rights to privacy regarding their academic progress. So in these simulation scenarios, when I talk about debriefing, running that debriefing, we have to make sure that we're doing it in a very non-judgmental tone and environment. and really supporting that across all the students and making sure that everyone understands that we're not being judgmental, we are critiquing to better each other. We also need to assure that as faculty, if we have any concerns regarding that student's performance, that we have to give that feedback to that student in private, because we're representative of the school. And that protects the student's privacy in regards to their actual academic progress in the eyes of the school. It's the same idea that when I'm teaching clinical, if I have a student that has either done a near miss, or they've done something wrong while we're in the patient's room, or they're about to do something wrong, I can't call them out and berate them in front of the patient. I would never reprimand a student in front of a patient. I need to take them into a separate room in a closed space, a calm, quiet environment where we have privacy, and debrief with them and discuss what happened and what we can do to prevent this from happening again. And the financial implications with these high fidelity simulations, as with any good computer, they come with a price tag. So according to the website Health Leaders, a simulation mannequin with the computer programming with it and additional accessories can cost up to $60,000. And that was in 2009. I would not be surprised if that quote was much higher now. And that's a lot of money, but I think it's worth it. Is it not worth it? I mean, if you think about it, and I ask you this, is it not more valuable if we use this, if we budget for this technology to improve the learning outcomes and the success of our graduating nursing students? What about to have a higher reputation for our school, or to have a higher enrollment rate because students want to come to our school to learn on this technology, or to have hospitals or other healthcare facilities actively seeking out our students that are graduating for employment? I think that's one of the highest honors. When I was doing my associate degree, all my professors kept resonating was that they want our students because you guys learn in the best way. And that really speaks for the university. In conclusion, so technology is only going to further advance the nature of nursing itself and what we know nursing to be. And it's also going to advance the way that we train nurses, and it's going to change the way that we're changing nurses. We already see it. As we've learned over time, the way we train is changing. I think about stories from back in the day that I've heard with some older nurses that I work with, where nursing students used to start IVs on each other. That's not practice anymore. But we now have technology that can mimic real life patients and real life scenarios. This allows us to do controlled and focused evaluation of nursing knowledge. We don't have to wait for these situations to arise in clinical. We don't have to worry that the students are never going to get exposed to these type of situations. We can make those situations happen on these mannequins. We can get those students that exposure. We can challenge their critical thinking skills and promote teamwork amongst the students. Implementing this technology will even further draw in more prospective students into these nursing programs, and that can offset the cost of this technology. Higher pass rates and greater clinical success will have employers seeking out these graduates that have trained on this technology and perform better in clinical. The college and university will become a valuable part of training a highly skilled future nursing workforce. In addition, the simulation technology is nice because it can also be implemented in work sites to allow nursing staff to keep up on skills. Perhaps there are nurses who work in certain units who are not exposed to certain clinical scenarios as frequently as other units are. We can keep those scenarios and those skills fresh amongst nursing staff. That's going to allow the entire hospital or healthcare facility nursing staff to overall perform better if we're keeping that information fresh. So in conclusion, high fidelity simulation is a very valuable tool. These mannequins are so advanced and can do so much good for nursing students and for currently employed nurses in our workforce. And I've attached my references on this final slide. some really great information in all of these articles. I really enjoyed learning more about this. And with that, I want to thank you for taking the time to listen to my presentation and scroll through here with me. Thanks for your time. I hope you enjoyed.